The brain is the most complex part of the human body. This 3-pound organ is the seat of intelligence, interpreter of the senses, initiator of body movement, and controller of behavior. Lying in its bony shell and washed by protective fluid, the brain is the source of all the qualities that define our humanity. It is the center of our corporal universe. And when something happens, it can be devastating, not just to the individual, but to their loved ones and their community. Did you know that an estimated 6.8 million people in the United States have an unruptured brain aneurysm, or basically that's 1 in 50 people? The annual rate of rupture is approximately 8 to 10 per 100,000 people. About 30,000 people in the United States suffer a brain aneurysm rupture each year. A brain aneurysm ruptures, get this, every 18 minutes. That's mind-boggling for me. That's sort of a bad pun, I'm sorry. There are almost 500,000 deaths worldwide each year caused by brain aneurysms, and half the victims are younger than 50. So I hope my audience will pay attention to that. Brain aneurysms are most prevalent, and this was a surprise for me when I read it, in people ages 35 to 60, but can occur in children as well. Most aneurysms develop after the age of 40. Women are more likely than men to have a brain aneurysm. It's a 3-to-2 ratio. And women, particularly those over the age of 55, have a higher risk of brain aneurysm rupture than men, about 1.5 times the risk. African Americans and Hispanics are about twice as likely to have a brain aneurysm rupture compared to Caucasians. So why don't we know more about brain aneurysms? Wait, I know, because it affects women more than men. Okay, that was pre the breast cancer and Me Too movement. All poor humor aside, and I'm sorry I had to do that, but in thinking about this, I was like, wow, so why? And this really isn't a laughing matter. I know I made a few jokes, but in my personal experience and what I have seen firsthand is a friend who was a fellow book club member, mother and nurse, died of a brain aneurysm back in 2005. She was in her 40s. I hope we've made some educational medical progress since then, and we'll soon find out from my fabulous guest. It was truly a shock to our community, and the worst part was that her being a nurse, she knew as it was happening that it was serious, it was so sudden, but it came on so quickly, and some things, no matter what the signs, cannot be avoided. But what about the ones that can? Ruptured brain aneurysms account for 3 to 5% of all new strokes. But I want you to know that there are very important differences between a stroke and a brain aneurysm. And from my very, very limited knowledge in researching this topic, and also being on a mobile stroke unit committee as part of the UCLA Health System Board that we raise money for this really important issue, both are really serious. Brain aneurysms are like balloons popping or a pipe bursting in your head. And a stroke is like a roadblock or a traffic jam. And that's why early detection is so incredibly important. Among patients evaluated in an emergency department for headaches, approximately 1 in 100 has a ruptured aneurysm, according to one study, and then another study actually puts the number at 4 in 100. I think so often we get a headache and we think it isn't a big deal. And then as it may get progressive or worse, we really do need to have someone assess us. Accurate early diagnosis of a ruptured brain aneurysm is critical, as the initial hemorrhage may be fatal or result in devastating neurologic outcomes. Welcome to Small and Gutsy, our podcast featuring nonprofits and social enterprises under $10 million. My name is Dr. Laura Shirk-Witkoff, and I'm excited and proud to be your host. We hope you'll love the stories as much as we do, and perhaps you'll find needed services, a job, volunteer, invest in, or donate. Small and Gutsy is not just a podcast, but a 501c3 nonprofit. Our vision is to spotlight every smaller nonprofit and social enterprise to raise their visibility. So please help me with our vision and send me any organization you'd like featured to laura@smallandgutsy.org. The Brain Aneurysm Foundation, located in my former home state of Massachusetts, is the globally recognized leader in brain aneurysm awareness, education, support, advocacy, and research funding. Established in 1994, the Brain Aneurysm Foundation, known also as BAF, aspires towards a life without death or disabilities caused by brain aneurysm ruptures. The foundation wants to keep families and communities whole and keep people in the workforce. Brain aneurysms are treatable, which is why identifying an aneurysm before rupture is critical. With research and appropriate scanning, we can all get a step closer to preventing ruptures, disability, and death. Today, the Foundation has a medical advisory board made up of dozens of the world's foremost aneurysm experts, neurologists, neurosurgeons, interventional neuroradiologists, and other brain aneurysm specialists from leading institutions around the globe. Over the past decade, the Foundation has provided millions of dollars in grants to academic researchers working to develop promising and potentially life-saving innovations for brain aneurysm treatment and prevention. In 2025, the BAF will mark its 31st year supporting the brain aneurysm community. Pretty darn amazing. I am so honored and excited to welcome my guest today, Christine Buckley, who has a wicked Boston accent, and more importantly, is widely recognized as a steadfast advocate for brain aneurysm patients and their families. She has been associated with the Brain Aneurysm Foundation for probably over 22 years, first as a volunteer and board president and as executive director since 2006. Under her leadership, the Brain Aneurysm Foundation, currently the largest private funder of vital research in the US and Canada, has invested almost $5 million in support of groundbreaking studies focused on early detection, improved treatment modalities, and the technological advances that will ultimately improve outcomes. Despite the widespread availability of brain imaging technology that can detect an aneurysm before it ruptures, misdiagnosis and delays in treatment occur in 25% of patients seeking medical care. And in 3 out of 4 cases, the primary cause of a misdiagnosis is a failure to order, get this, non-invasive diagnostic imaging. That's why Christine, a graduate of the Eisenberg School of Management at the University of Massachusetts Amherst, created the Scan to Save initiative. I love that name, unbelievable. A public health campaign designed to help physicians and patients quickly recognize the early signs of a brain aneurysm. This really reminds me, sadly, of my own breast cancer journey and diagnosis, where my diagnosis was actually delayed to the belief that an ultrasound wasn't necessary, which ultimately was the diagnostic tool used, and then eventually an MRI. My prognosis would have been much worse had I not pushed to get my non-invasive diagnostic. And since then, Katie Couric has become an ambassador for ultrasounds, as my guest is for brain aneurysm diagnostics. Christine has launched a number of successful initiatives, including an annual road race that has to date generated well over $1 million. We definitely need a Christine Buckley to fight for this often misdiagnosed killer. Welcome, Christine. You clearly have a passion to educate and raise funds for the Brain Aneurysm Foundation. Your passion started over 20 years ago, and I would love to sort of get a sense of what was the impetus and what changes have you seen basically since when you joined and also when my friend died in 2005, because I know there are enormous changes. So the floor is yours. Thank you for letting me go on, but reading about it really moved me.
Yeah, you gave a wonderful synopsis of what an aneurysm is, what we do, the problems associated with it. So first, thank you very much for having me as your guest and an opportunity really to speak about the disease almost more than the foundation itself. I mean, you highlighted so many of the points that, 1 in 50 people impacted. But I think the biggest things for people to know, it's a very treatable disease. We try to tell them, but you can't treat what you don't know that you have. So things that have changed since earlier on are the treatment methods. Initially, it was just clipping an aneurysm at the base, where you have to remove a part of somebody's skull to do that.
Wow.
Now it's a lot less invasive with coils. So they take a stent where they go through the groin and all the way up to the brain and release these coils.
Yeah.
Sometimes they fix them a little bit more with a stent. Now they even go through the wrist.
Wow.
Sometimes they do the clip procedure through the eyelid. So the treatment methods keep changing and getting better and better and more efficient and better at saving lives and reducing disabilities of those patients. You touched upon why do people not know more about this? I mean, that is still the mystery, right? And that's one of the things we're trying to break through. I mean, we want to be like American Heart or Stroke. Everyone knows heart attack signs. They know stroke, the FAST, F-A-S-T, face, arm, speech, time. A lot of that is very similar here, But the aneurysm is different. And like you said, the aneurysm, it is a form of stroke. It's a hemorrhagic stroke, but it's a bleed.
Yeah.
It's when the vessel in the brain, for some reason, there's a weakening with a constant blood flow. That weakening of that wall just suddenly pouches out, and then the blood forms there over time. And again, another part with this disease, there's so many mysteries as when they form, why they form, if you have it, will it rupture? There are some people who will die with an aneurysm and never know that they had it. So there's a lot of mystique to this, even from the medical community. There's not any real certain answers, but you touched upon the average age, 35 to 60.
Yeah.
That's basically prime of life for people, right?
Yeah.
So as you mentioned, it obviously impacts the patient, but I mean, families, communities are so impacted by this, because when someone does have this rupture, if they don't have the ability to have early detection, and where the treatment is obviously, that treatment is almost like anything else. You're going in for a procedure, and it does have some risks like any other procedure, but it's that rupture we're trying to avoid.
Yeah.
So when someone ruptures, it's kind of like a third, a third, a third in terms of their disabilities and how they come back. So 2/3 really have life-altering disabilities, and then a third where things are really pretty good. But the people who have the bad outcomes of a rupture, oftentimes they can't go back to work.
Right.
So right there, their day-to-day activities, how they live and what they do and interact with people change. Another thing that's a problem for people who rupture, and they're able to communicate and walk and speak, and they will look like you or I, but on the inside, they're very different. They're tired.
Yeah.
Light and noise might bother them. There's things that they can't do the same that other people don't see. And that's like a heartbreaking piece of the struggle. Like, they're fortunate to survive, but their life is forever changed.
Yeah.
And on the outside looking in, people don't see it. So there's then a lot of mental health issues and depression and anxiety associated with it. So that is a heartbreaking thing. And again, where half the people die, half of the voice of this disease to come and speak about it is immediately lost. And for others, again, their life is so changed. There's also that stigma. If someone is able to go back to work, but they might be a little slower,
Right.
or a full day may not be something that they're able to carry through, they also get looked at differently. And I knew someone that had a brain aneurysm and prior had breast cancer. And she said when she went back to work after breast cancer, no one ever judged her for forgetting something or doing something differently. But when she went back to work after an aneurysm, she was looked at because she had a brain injury. Oh, you can't do that the same. You're not working to your potential. So there's a lot involved in this disease.
You've said so much, and I just want to make a few comments. So the first is that when somebody does go back, the hardest thing is they're conscious themselves of the changes. So that also then creates the mental health issue, because they're aware. There's an awareness for them, which I think is devastating.
It
from
is.
where somebody was to then somebody is. Cancer can have similar pieces to it, but not in that same way when there's pretty much what feels like a permanent shift in the hub of our body, which is our brain. It's really where everything comes from. And it's really frightening. The other thing is, and I know this may be a stupid question in my reading and sort of learning about this, when an aneurysm ruptures, is it 100% automatically death?
I mean, similar to a stroke, the time is critical to get to somewhere where there is somebody that can deal with it. You have to really be in a city. So if you're in a more rural community, that's a definite disadvantage, because you'd probably have to be med flighted, because local hospitals just don't have people that have the expertise to treat this. So it's basically 50% of the time people die, and that like 25% of the time they die before even reaching the hospital. So the time and where you are is certainly critical. And then when you arrive, it's also someone diagnosing it properly. The education piece is for you and me and the general public, but it's also for primary care doctors, for ER professionals, and EMTs, because sometimes someone, either like an EMT could come, and I've heard many different stories. Sometimes they think someone is on drugs, and they're not even thinking brain aneurysm. And that's part of like the medical education we do, and we've done different things with primary care, ER, and EMT, is to think brain aneurysm in their differential diagnosis. Like, just think about it when you see certain signs and symptoms. And you had mentioned before, like, people get headaches all the time. And again, being involved in this in a while and talking to people who've lost somebody or someone that's fortunate enough to survive, oftentimes you will hear them say, like, this person had these headaches and they had neck pain, but they kind of just shrugged it off and thought like, this is okay.
Took a Tylenol and thought it'll just go away.
So that's a big struggle for us organizationally, and what we're working at is just the overall awareness to the signs, symptoms, and risk factor. And it's like anything else, you have to be your own best advocate. And our board chairman, now I think probably his rupture, he subsequently had an unruptured aneurysm treated, but when he ruptured, he had gone to his primary care doctor. This was somebody who worked in city government, very used to stress, working hard. Went to this primary care doctor because he hadn't been feeling well, having these headaches, and it was a new doctor for him. And when he left the office with a week's worth of sleeping pills and pain medicine, so as he says, to mask the symptoms and make him sleep,
Yeah.
right? So he doesn't notice anything. He said to this doctor, I know you're the doctor, but I don't think you're listening to me.
Wow.
Because he knew, he's probably had headaches in his life, but he knew he was different.
Mhm.
And 6 days later, he was doing a charity auction and the rupture occurred. He was fortunate to have his wife there, take him. He was very lucky to be in Boston. He went to one of the great hospitals, one of the great options, and they got him in and they prepped him to the fact that, you know what, you should say your goodbyes to who you need to because you may not make it till tomorrow.
Ugh.
Fortunately, he did. He got the treatment he needed. But again, unfortunately, he also had a second one. But where that second one was, they didn't want to treat it because the risk of treatment was going to be too risky to then cause that to rupture.
Ah.
So not only did he have this horrible rupture experience that could have been avoided had this primary care doctor ordered him a scan to begin with and had seen the two of them,
Right.
made a decision treatment, got in and done it. The second one, they waited 5 years. He and his wife and 2 kids, after seeing him almost die from a rupture, had to live with what's going to happen. Is this really going to be okay? But again, with changes, 5 years after, they were able to go in with a pipeline stent and they went through his wrist and he was home the next day with a pin prick
Unbelievable.
on his wrist.
Yeah.
Oh, but in the meantime, it wasn't fun and games for him. So he was
horrible.
never happier till he came back from that second one. But he had a whole host of things, it was awful.
Look how he's giving back now,
100%.
which is really amazing because I learned from my own experience, be your best advocate, then help other people advocate for themselves because people don't know.
Right.
And we rely on the medical community, and I love the medical community.
Yeah,
but
we all do.
Things get missed, and they're busy. It's interesting because being part of the mobile stroke unit sort of subcommittee of the UCLA Health System Board, they have an actual vehicle that goes around, and it's purely for diagnostics because the minute you can diagnose, this is for stroke, but obviously brain aneurysm falls into that, then they can direct the person to the hospital to get it managed. And usually if it's something that can be eradicated very quickly, it's done. And they have a scanner in the vehicle, which is really incredible. Right, amazing. Yeah. I think there are probably 30 in the world. There may be more, I'm not sure. They're very expensive, but it's worth it. And what they do here, which is wonderful because you're talking about rural communities, is they go into marginalized and lower resource communities who don't have access to UCLA Hospital or Cedars-Sinai or one of the bigger hospitals here.
Right.
So I'm proud of that. But the same with the situation you're in is there is not a lot of awareness in terms of recognizing any signs. And it's a hard sell sometimes to say if you have a headache or if you have a series of headaches or what's the time limit. So I want to take a step back. How did you get involved? And then I'd love for you to share, what are the signs? When should people be alerted? What feels like hypochondria versus let's really make sure we're okay? Because it is a fine line for people.
Right. So I got involved. I'm the youngest of 5 children, I like to tell people, and I always talk to volunteer and help out. And my older sister is a nurse practitioner in this space, and she was working at Mass General at the time, and there was another nurse who had a rupture. So this is back in 1994. So after this nurse survived, she went to her treating physician, Dr. Ogilvie, that my sister still works with at BIDMC here in Boston, and asked them, will you help me start this foundation? Because, I have a medical background, but again, in 1994, pre-web, there was no information. Like she had no idea what to expect in her recovery journey. So they basically agreed and started this organization, and honestly did it to just sort of lend support and raise some awareness very locally. And they had no foresight or plans down the road. There was not like a strategic session. They're just like, yes, we're going to help you and we're going to do this. So little by little, it just started growing a little, getting more attention. And, they're treating these patients. So just lo and behold, she dragged me in for some local fundraiser and silent auction. And that started my 8 years of volunteering, just helping out with events. Started this local road race that we now do at Castle Island in Boston that has been that flagship event and grown so much over the years. And I have a healthcare finance background, and I was working part-time for a consulting company when I was volunteering. So I really did get involved quite a bit. And then it led to being on the board. So in 2002 was the first website the organization had. So when that went about, it's like, bing, you're out there, right? People are finding you, things are happening.
Right.
So the organization just had some volunteers going in the hospital, like maybe answering a call or looking at an email. But again, the web was really what started the growth. So in 2006, another iteration of the website. And this time, again, I had been volunteering for about 8 years or so. We decided as an organization, listen, this is either going to stay very local and just have volunteers or, should we hire someone to start paying attention to people who are reaching out from all over because they are looking for support and information. So there was a search to get an executive director. At the time, we had $60,000 in the bank. So there were people who had reached out and were definitely interested, who for sure probably had more qualifications than I did. But when it came down to it, nobody accepted the job. So the treasurer reached out to me and it's just like, you've been doing this for so long, would you consider doing it? So
Wow.
at the end of the day, I said, I'm in it. Like people always ask me, do I have a personal connection? I mean, I feel like I have for years because of all the people I have met and become friends with and, like parts of my family. I feel like, yeah, I definitely do, but in a different way than what people are thinking. And actually, the fun part about this was my sister was at a research meeting in France, and she came home and I had the job. So she had no idea. She was like, what? I think my mother told her. She's like, what happened? It's like, surprise.
That's great. I love it.
I did it because, again, I was healthcare finance. I was dealing with numbers, like not that exciting. And through the volunteering, it was the people I met and the fact that, come on, there's no way, like I kind of can't screw this up because we were at bare bones at the time. And I just figured it can only go up right now. So
one way, right? Which you did and have.
yeah, with some other great team members that I have. But yeah, there's been some great growth. And the research program I established the first year I came in, I was like, I really think the way to get more money is we got to start giving some to research because people definitely care about that. And that's definitely a good thing. So a lot of people who do events for us, I mean, we are very grassroots funded. We don't have any grants from the federal government or state. And it's sort of upsetting, too, that we are supported by people impacted by this disease are the people who really carry us. But then people set up tiers of research either in their name or a loved one. That program has developed really well to a different city and state every year. So the researchers get to meet the people who are funding them and hear their story. And it's amazing how much the researchers appreciate that connection. So that's been, a wonderful program. It's one of the best times of the year when all these different people come together in support of that. And the people love to meet the researchers, and it's amazing.
And it brings the lab to life.
Exactly.
Right? It brings, right? And then they have this personal connection and they would do the research anyway.
Right.
But I think that people are more incentivized
100%.
when they see that they're really exploring an area that is going to help people. And the people who have been helped come back very often.
Right. Makes a difference
to
for
sort
sure.
of honor them in a way. Yeah, I think it's a beautiful, incredible thing. I love your story because the idea of giving back is something that should be, I think, part of every, they have that in sort of educational, in schools, like part of your community service. But yours really stuck, like you were part of your family. But I think it's so important. And also, I think what you said was you were already involved in healthcare on the financial side.
Right.
And so what you got, similar to the researchers, is you got to meet and connect with people in this particular arena of healthcare where you see that difference, you see that experience,
Right.
you see what they're going through. And you're there for them, and you're doing whatever you can to sort of promote both the outcomes, the improved outcomes, as well as the diagnostic piece, which is so important.
No, it is.
So talk a little bit about sort of the educational. There's a research component. Talk about how you've really tried to get folks to start to recognize, both on the physician EMT side, even the healthcare practitioner side, and then on the layperson side, because those are all arenas.
I mean, I think the layperson side, and nowadays, that's almost a component of everything we're doing, like any outreach, the website, the social media, just sharing the statistics and the facts. And the biggest thing, when some people always want to know, how to help or how to get involved and all. The easiest way and the simplest way for anybody, if you follow our social media and you share it.
Yeah.
Because we are not connected to the people you're connected to. And it's you sharing that and people helping us educate the other people. So, and we have webinars, usually monthly webinars that we do with a different topic and things like that with a physician or a guest speaker addressing different sides of it. And we share that out again in different platforms. We've had local symposiums in conjunction with some of the companies that make some of the clips and things like that have sponsored us and brought us on. So we go as well to conferences across the country, sharing our educational information. We have booklets on recovery, booklets on the treatment and detection. We also have support groups with all the doctors on the medical advisory board. So again, the lay side, it's sort of connected in any messaging, anywhere we are getting the word out, however we can. And then on the physician side, we have done different things. We had once created a DVD that we distributed to emergency rooms and EMTs across the country. That was great. But I think the thing that has had the most impact is there's a local organization that's national. It's called PriMed, and they provide the CME accreditation for primary care doctors, NPs, PAs. So what we do is we have doctors on our board provide this lecture on the detection and management of brain aneurysm. So we do live ones, and then we've had a sustaining one online. So when it's live and we do it all over the country, there could be like 800 to 1,000 people in that audience.
Wow.
And the amazing part about this is I get the feedback forms and the doctors there ask the questions, but the number of doctors who say that they will change their practice based on this lecture is usually around 90%, which is amazing.
That's amazing.
And the different doctors that have given the lecture always come back to me because before they can leave and get off that podium, there's people lined up to ask them more questions because they're thinking back to someone that they probably know they didn't scan that may ended up having one. And so the thirst for that knowledge is there. We've had conversations with different medical schools to try to implement more education at that level, not super successful with that because people like to say, oh, we cover it, but it has to be refreshed, like through these CME accrediting programs. Seems to be the best way. And actually, one of the doctors who's done these lectures in different parts of the country went up to the podium, and there was a note, handwritten note there from someone who had heard his lecture either a year or two before and said, I just want to let you know that this one patient of mine is alive because what you said and how she presented to me, I ordered them a scan.
Wow.
And they're here today because of this. So, I mean, that's pretty amazing, right? It's a costly venture for us to do this, but which we say all the time, if it saves one life, it's worth it.
Totally.
And this was like a clear indication. So this doctor was just blown away before he got up to do the lecture again. So it's critical, and the people there do listen. So I think that's something I'm really happy that we do and continue to do, because it is hard for a primary care doctor to have somebody coming in saying this and that and them just, cipher out what it is. But again, we just want them to know brain aneurysm, bring it into your differential diagnosis. And it's an ugly term, aneurysm, like when people first hear it and how do you spell it and all those things.
So true.
But on the medical side, just to really think about it when someone is coming with the headache, stiff neck, but really conveying that they feel differently. And again, the key symptom of a rupture is worst headache of somebody's life, in which case they should immediately seek treatment, because sometimes you can have that in the bleed. I mean, people think like when they hear there's a bleed that, there's all this blood. It's like a pinprick size and blood comes out. Sometimes it seals itself off. So sometimes it's called a sentinel bleed. So it's like a warning leak. So someone's going to have this tremendous headache.
And then it goes
away. But then it may subside. But if you ever have that worst headache of your life and are lucky enough to kind of have that warning, you need to seek medical attention.
Yeah, for sure.
Right away. But even on the more subtle sides, again, it's the lack of awareness. We aren't heart attack and we're not stroke.
Right.
We have to be that same level. People need to know the term aneurysm. And we don't want to ensue panic. We don't advocate to just anyone getting a scan for no reason. But
course.
there are plenty of times that people have that need, in which, the Scan to Save was designed for the fact for people to advocate for themselves.
I love that term, and a lot of course, for brain aneurysm, but even for any sort of
True.
way to think about it, because this is a prevention, or really it's a diagnostic rather than a prevention, but then you can do something about it once you know. The story that you shared about the note on the podium gave me chills, frankly. I'm sure it did the doctor. I
Oh,
hope
100%. He saved it. He
now-
has it.
Yeah,
Yeah.
yeah, and you should share that at the beginning of every lecture, honestly.
I know.
Because it really does make a difference. And, personally, in a completely different realm, and I'm sure other people feel this way, I don't want to bother my doctor. Now I go to the doctor all the time because I'm a cancer patient, but I go to my primary care. And it's so funny because initially, he wanted to see me every few months during my active treatments of chemo and radiation and everything. And I thought, and for blood work or whatever. And I was like, that's ridiculous. Why do I need to go to my primary care? Like, this is ridiculous. And he's a friend. I joked with him. And he goes, well, I just want to make sure we have a comprehensive, like someone's watching everything. And I never thought about, my GP is my best. He has saved my life twice. And I'm not exaggerating.
That's amazing.
Because I went to him and I had a swollen ankle that I thought was a bug bite. And I was on a cancer prevention medication or treatment medication that gave me major blood clots.
Oh,
They thought it was only to my knee.
Wow.
Then I had 10 flights that summer back and forth to graduations and this and that. I should not be here today. And I said to him, do you think? He said, well, it's not in we've got to get rid of him, so I'll put you on medicine, but it's not in your lung. Didn't go to your heart, didn't go to your lungs. And I said, well, I've had a lot of stamina issues. And of course, my oncologist, who I love, and my radiologist, whom I love, said, oh, that's just, you're getting, you've just finished treatment. It's going to take a while. You're not, and I like to play tennis. And so I couldn't hit the ball. Like I would hit it once or twice. It was like, oh, I was breathing, but they never said, are you out of breath? My interpretation as a layperson is being out of breath is you can't breathe.
Right.
Okay, I know what it means now. And so they did a CT scan. I had blood clots in both lungs. I mean, I was really...
Oh my gosh. That is insane.
Perfect example of look, I don't know how other people are. I don't want to be looked at as, oh, you're just overreacting.
Right.
Oh, it's a little headache. It's going to go away, not to worry about it. And I think that I love your advocacy because even in a different realm, I had put myself in jeopardy and had no idea because I didn't want to bother someone, or I thought it was like whatever. And I thought I had a bug bite that, wasn't.
Right,
and
right.
I'm a much more aware advocate. And more importantly, I think that I'm an advocate for other people in their health care as a result.
Absolutely, you are.
Well, and as you spread this, yes, it's brain aneurysm, and it's a death sentence if you don't do something about it,
Correct.
potentially, or certainly life-altering. And so to be able to really help folks, and now I feel like I want to be on that bandwagon too. For any issue, take it to your GP, push, ask,
Right.
do some research, get the questions out there.
100%.
You don't want to be a bug, but you also, there's a difference between really understanding and knowing your body. And it's hard
It is hard.
because I didn't know. I thought, oh, this is normal.
Well, I think nowadays everyone's busy and they don't want to stop and take the time. But we even have people who call us like post-treatment or maybe pre, asking us things. And, it's like anything else. Everyone's aneurysm is very different. The location, the size, their age, their overall health. And we always tell them, go back to your doctor or the nurse there. You have every right. Ask the questions, because we are not medical people. We cannot give medical advice, but people are hesitant. And it's like, absolutely, don't feel badly. And particularly something when it's this serious, if you're at the doctor and you don't have someone with you and taking notes, we always tell people, write things down. I mean, it's super, super hard. I mean, it's a very frightening diagnosis to begin with. But I do feel the medical community is getting a lot better and paying attention to the patient outcomes. I'm involved in a lot of things, reaching out for people to get surveys to ask the patient how they are. Basically, a surgeon's going to say, if you walk out that door, they're good,
Yeah.
right? Like all the deficits that we talked about, the psychological, there's physical, there's speech, it's all these things. But now they're taking into account, okay, we saved this person. well, what is their life really like to also to better understand the disease, how they treat it, and how they can fix changing some of these long-term effects afterwards. So that is something that I feel is very positive. And in some of these surveys, they're also asking for the feedback of the caretaker of this person, and how their life
That's
has changed.
great.
So again, on the upfront, how can we avoid this more? And again, with this disease, it's avoiding the rupture.
Right.
Let's find this, let's treat it, and let's do it in the best way possible.
Well, the outcomes are so much better, clearly, if the diagnostic is there and you can treat it. And I love what you said, because I think in a situation where it may be unavoidable and their quality of life has changed so dramatically, helping them navigate that and getting the supports they need in order to really live a life that they maybe didn't imagine, but they can sustain. And I think there are ways to do that. I also wonder, I know this is a little sort of far reaching. I used to work at an employee assistance program and doing sort of wellness work and as a social worker. We used to do a lot of education for employers around return to work stuff. And so it would be very interesting. I don't know that there's anything out there, but I think when someone returns to work, certainly after a brain aneurysm, there should be some education for supervisors or employee around,
Absolutely.
because that person it does impact, and they're going to be looking for someone to respond to them maybe in a way that didn't feel like it was before. And so that can be off-putting for folks too.
Oh, 100%. That's a great idea to educate the employers of people as they do come back, because it's hard, even with their own families. People are not understanding of, again, because when someone is treated, they come back looking like we are looking at each other.
Right.
And they expect them to be the same, and they're not. And that's again, it's a very hard part of this disease.
Yeah. I have a couple of questions around that. I'd love to hear any stories you want to share. You've been there such a long time. I'm sure you've seen tons of stuff. And I don't know if there's a story or two that you'd like to share.
Sure. I mean, there's some that definitely come to mind. I mean, I shared the board chair, and that was like classic misdiagnosis. Another tragic one was a 14-year-old girl, I want to say now, probably at least 10 years ago in North Carolina, who died of a rupture on her second day of high school. And again, because she was female and 14, there was just a lot of off-putting of not scanning her. And ultimately, she ruptured. So our legislation on Capitol Hill to get more research funding through NINDS for the disease is called Ellie's Law.
Great.
But again, ultimately, the aneurysm she had, because of its size, potentially may not have been treatable and may have had a bad outcome if they had scanned it. However, they didn't. And she was 14, and they assumed some different things, maybe with hormonal changes and things like that. They just didn't even think about it. They just never even thought to do the scan. So that's a tragic one. There's someone else who used to be on our board. His wife ruptured very badly. At the time she ruptured, they were a little more, I mean, not rural, but away from the city, kind of got delayed care. And to this day, and I think now it's probably like at least 15, maybe 20 years out. I mean, she needs all types of care every day. They recently moved to some warmer weather, so she's out on this mechanical bike that he got her. But at the time of her rupture, and kind of, again, delayed diagnosis, because EMTs never thought anything. They just
Right.
thought, they just didn't know. Oh, they just didn't think that it was something this serious. Her 3 kids were probably all middle school age. And the dad's amazing, like one of the most amazing men I've ever met, just because of his compassion, the love for his wife, the care. He's done everything he can for her and has been by her side. But, he says, and luckily now he just retired and wants to get more involved again. So it's a good thing.
Yeah.
But he said, initially, and it's like anything else, when tragedy strikes, people help with appointments, people help with meals. Work was really understanding.
It's exactly what happens.
Then there's one day, they had to adjust the home for her and do all these things. And he had to work, the kids, and blah, blah, blah. So, I mean, forever changing their life. And she has things still consistently. I just talked to them the other day where, she had a fall in September just off the stool in the kitchen. Again, her balance isn't right. So there's so many, their day to day has changed.
Yeah,
forever.
for sure.
And there's all rehabs, all kinds of battles. And with her, it was never even thought like, oh, this could be an aneurysm, let's go faster. And he just remembers the slow response, them getting her out of the house slowly.
Unbelievable.
So for me, it's heartbreaking. And I mean, it's a recurring theme to see a family like that disruptive. And I also always feel horrible for the caregivers because as much as you want to support them, you can't really change the role that they're in.
Right.
You just have to be there for the support. You know, and with the support groups, we often have the people always have a session or a break off for the caregivers because they need that time
That's great.
to decompress. So, I mean, scenarios like that are really sad. There's also a family that's been involved, walked down the Jersey Shore and also supported research. Their daughter and sister, Kristen, died after giving birth to her son, like the next day. She had a rupture there in the hospital.
Wow.
So never met her child. And there was definitely some things there, I think, with complaining of the headache. And they thought it was maybe from the epidural and missed things. And she doesn't have her baby. And like out of this joy that everyone's expecting and have, I mean, tragic again. Another one that breaks my heart, there is a young man, I think he was probably early 20s, and he was mowing his lawn. His family was up on vacation in Maine. It was in the summer. He was going to meet them, and he just collapsed. And someone, I don't even know, an aunt or somebody found him, called the family, said Michael's had a brain aneurysm, and they were like, what? They came rushing home. And he's done amazingly well. He does a lot of advocacy for us. He does a lot for the Brain Injury Association. He did go back and get a degree locally, but his life is forever changed. And he's not the same young, vibrant young man in life he would have gone off to. And, the dad is with him and by his side all the time. I mean, his whole family is great, but it's just a complete change. And you just he's a big kid and breaks my heart. Like I have a 28-year-old son and a 25-year-old daughter. And if I just saw something come out from them and what you had hopes for them,
Right.
just super sad. Another local family that has just been amazing champions for the cause. And again, it's heartbreaking. Our support and energy is coming by people impacted by this. I'd love to get some more grant, federal funding or whatever, but that's a whole nother topic. But the loveliest people and their daughter, Caitlin, age of 31, ruptured and died. She was engaged to be married, just bought a house with her fiance. She was in the medical space as well and had some headaches and went to the doctors and was not scanned.
Unbelievable. These are like tragic. I mean, some survived, some didn't, and it's part of the nature of why you're doing what you're doing, clearly. Do you want to share any stories where there was an early diagnostic and where it was treated and people have come back as fully as they can?
Well, I mean, there are definitely things, sort of like that doctor's note. So sometimes if there's something in a local paper where someone is telling their story, then someone will reach out and say, because I read that, I noticed I had those same signs and symptoms, and I went to my doctor and I got scanned. So clearly the awareness and education piece does matter because some people see it or just talking about it or recognize there was someone's aunt was a nun and her nephew had an aneurysm and she was in where she lived with her fellow nuns. And one night she had the worst headache of her life and she screamed out brain aneurysm.
Wow.
Passed out, but they told the EMTs that, and they also knew her nephew had one, and she got treated and saved because of that.
Wow.
So there are definitely stories when someone does know and they are aware. And again, in sharing these, that's why it's always good when we try hard to get into newspapers and different communities. I think almost every time we do, it does have an impact. And I think not only today, like a newspaper just isn't a hard copy, it's online. So more people see it.
Right.
So there are definitely examples of that where just because someone saw something that we had or heard a story from somebody else, that they then were able to seek treatment and, advocate for themselves to get a scan. And that's part of the problem with our Scan to Save campaign. But the reason why it's about advocacy is because insurance companies only will pay for a scan if there are 2 or more people in a family that have had a brain aneurysm.
Unbelievable. Wow. I did not know that.
Yeah. So when we go to Capitol Hill and are talking and people sharing these stories, sometimes just people on the Hill are like, that's crazy. Like, why would you wait for a second occurrence of this? But
Right.
I mean, everything is money, right? And they're not going to scan everybody. So another initiative down the road is to try to figure out a way to work with Congress and insurance companies to really realize the benefit of saving somebody like Caitlin at 31, who, if you had paid for a scan, would still be here.
And I think that what's so ironic about this, it always sort of startles me because I've had to fight insurance companies for some things that I've needed. And I think if the opposite costs much more money, right?
Right.
I mean, you're in the finance world and I'm certainly not, but
Right.
I'm that. So diagnosis and treatment is so much cheaper than letting it go where then something happens and the aftercare and the quality of life and the treatment on that end is far more expensive.
But again, you have to really have the hard data to prove it. So those are the things we're working on and trying to figure out what exactly do they need to see in terms of cost saving data that would have them make that change and make that shift.
I mean, I think it would be not hard to look at how somebody who post-aneurysm who survived versus to getting the proper diagnosis in the beginning, how that insurance or how money has been impacted and the costs of that. Now, maybe that's not insurance costs, but I would imagine there's some insurance costs in that.
And the other thing, they do run in families 25% of the time. So at least when a family member knows, but we still tell people all the time to advocate for scanning.
Yeah.
To talk to your doctor. Some doctors will help advocate to try to get insurance company to pay for it. So that's another way when one family member has it. There's some really odd circumstances when sometimes you hear of 3 sisters, the mother, the aunt, and
Wow.
that's just kind of crazy. But we also had a past board chair when he lost his wife, started doing digging, found out on her mother's birth certificate, cause of death was cerebral aneurysm. Nobody knew.
Oh, wow.
So he told other family members, 2 sisters got scanned, one had one,
Wow.
and then a niece from the other sister had one as well.
Amazing.
So, I mean, he felt, he lost his wife, but then really digging, finding out it could be in the family, he felt great about saving those other family members.
And so those other family members then, I assume, were treated, or at least,
Yes.
So
Yes, and are good. Yes.
Yeah, amazing.
And again, that's the majority of the outcomes are definitely very positive when it's not emergent.
Right. That's why the prevention and diagnosis is so important. Is it often that if someone has one, that they will have another one, or is there no correlation there?
It's about 25% of the time
Yeah.
that occurs. So people definitely have follow-ups. And again, there's imaging. Also, like President Biden, I don't know if you know, he ruptured when he was in the Senate. Was lucky to survive that. And he had another one subsequently treated that was unruptured. So it does happen a fair amount of time, and usually does require more than one treatment, but it does happen. And, that's not an easy feat. And some people have multiple. That's, lesser, but people can definitely end up having more than one.
And they really don't know what causes it. I mean, they know general health, like, exercise, don't smoke, all of the typical things.
Right. I mean, smoking is probably the biggest link,
Interesting.
and if you have high blood pressure as well. So there are doctors who are working on to screen more, to develop a screening protocol to at least say women, because it's more prevalent, like we discussed first. Like if you're a woman in this age bracket, if you have high blood pressure and you smoke, you should get scanned because the prevalence jumps amazingly.
Wow.
So there is some literature coming out of that. And the same person who started that is doing it for men as well who smoke and kind of finding the same thing.
Interesting.
But again, no one knows. Some people are probably born with them and they can then develop later in life as well. So that's a hard part too, particularly going like advocating. The data is like a little shaky because there's no perfect answer. They just don't have it.
Yeah. And is the scan that one would get is an MRI?
An MRI or an MRA, and then something that is a little bit more invasive, but usually prior to treatment to really get a good look at one, they do an angiogram.
Wow. But these are all possible. We have this ability to be able to do this.
Yes. And the other thing through research is people are really progressing to develop a blood test.
Oh, fascinating.
So then obviously it'll be a lot cheaper and a lot easier and a lot more available. So there's some really great strides being done on that. So that's something that is very hopeful. And AI is also playing into it a little bit with better detection and treatment. So we'll see. But the blood test would be amazing.
Yeah, that would be amazing. And yeah, AI and the medical community are working on all kinds of things, which is really great,
Yeah.
particularly in the diagnostic side and being able to pull together data pretty quickly, which is amazing.
It is amazing.
It's really exciting. So outside of the challenges that you've talked about, which are really policy actually is a challenge, education in certain venues where you really want to get the word out. By the way, your website is amazing.
Oh, thank you.
I would love to drive people to your website because it really covers so much. What are some other challenges that you feel like the Brain Aneurysm Foundation is facing at the moment?
I mean, everything is money, right?
Yeah,
We
of
have
course.
very limited resources. I mean, we're a small group that's a national organization. I mean, this office we have outside Boston is the only one, and we're dealing with people not only in the US, but all over the world for that matter. So, I mean, resources are difficult. And just, I think, getting, and I hate this, is getting people who are of celebrity status to speak out about it. And there are people who have been impacted by this disease, but if somebody is up here, they're living their life and they're out in the public, they don't want to be seen as having any potential deficits that are associated with ultimately a brain injury. That's really hard.
Yeah, they don't want to be identified necessarily.
It's a terrible disease, like we said, in so many ways. And it's really hard. I mean, the people who advocate for us have been through something horrible, right? So there are some people who walk away from it too, and they don't want to talk about it.
Because there is a stigma, and I had not really thought, I would think it would be heroic, but there's actually a stigma. I really hadn't thought of it from that.
And we've even seen it in families where, particularly in the case of a loss, that some family members, they're at Capitol Hill with us or joining this walk, and others don't want to touch anything associated with that loss. And again, the overall awareness of this disease is just not where it needs to be. And I think we need a little bit more help from the medical community in terms of educating. And I think, again, a lot of things are involved with money. Stroke, there's a lot more incidents of stroke. There's a lot more drugs involved in stroke. Again, it's conversations that we have in terms of, you're talking about this ischemic stroke. Can you also talk about hemorrhagic? And you mentioned in the beginning, aneurysms are responsible for 3 to 5% of strokes, not vice versa. So if you help us with the aneurysm education, we're going to reduce a portion of these strokes that are then coming after the fact.
Yeah, it's a really good point.
So it is just a struggle, and we edge up a little bit, but we want that breakthrough moment. And that's what we're waiting for.
Yeah, I'm hoping that you get that because I think my own education in this realm was new, perusing your website and watching some videos and really understanding and really doing my own research, being part of the mobile stroke unit at UCLA. I'd love to connect you guys. You never know.
Yeah, that would be great.
Yeah, you just never know. So toward the end of my podcast, you may or may not know this, but I always do a round of quick and gutsy questions. Some you kind of already started to answer, which will be fun, but now you get like, okay, this is what the answer is.
All right.
So are you ready for those? There's
Game
no
on,
wrong
let's
answer.
do it. Yeah.
I love it. Okay, what is at the top of your wish list for the Brain Aneurysm Foundation? However, the answer can't be money or funding, because for most of the people I interview, of course, that would be the number one. So what is at the top of your wish list?
I think to not need to be in existence, because there is that blood test and we can eliminate the ruptures. I mean, that's part of the dream, to have a world without death or disabilities from brain aneurysms.
Yeah.
For me to be out of a job would be key.
Yeah, I love it. That's such a beautiful wish. And more people are impacted by this disease than I think the average person realizes, because I didn't realize it.
Once you start talking about it, everyone seems to know somebody.
It's amazing, right? It's amazing. If you were to think of a song that describes the Brain Aneurysm Foundation, what would it be?
Our awareness month is September, so we always like Earth, Wind, and Fire September, but that's not really
I love
the theme
it.
song. But I would say, James Taylor, You Got a Friend.
Oh, that's great.
Because we're here for anybody impacted by this disease, and we want to work with them to make this better for people in the future.
Yeah, and James Taylor's from your neck of the woods.
Exactly.
You know, we think about Massachusetts,
Yep.
right? James and Livingston Taylor
Yep.
and the whole group. Yeah, maybe he'll do a fundraiser.
There
You
we
never
go.
know.
A little plug there.
Yeah, you never know. Right, little plug, why not? What makes the Brain Aneurysm Foundation gutsy?
Oh, we are gutsy. We are small. We are mighty. I mean, there are 6 full-time employees that are doing everything. Like people, oh, can I talk to your marketing department? Yeah, you can talk to Lynn. That's it. That's her. You know? So I have some really dedicated people who have, like me, become passionate about a disease that they maybe did not know that much about or were directly impacted about when they came here. So, I mean, it is amazing when you meet people. I just feel you can't not care. Like if you come here and you want to work here, you're going to care. You may not think you are, but you're going to. So we have grown with very small resources, and our outreach has grown quite a bit. I feel we just always keep getting better. And, you know, we just did that new website last year. We're just here to be with the people and make things better. And again, the research we've increased every year. It's been almost 6 million we've given out. So, I mean, honestly, we scrap here every day. That's just what we do. So
That's great. I love it. In true Massachusetts form.
exactly.
Right?
I think that's part of it. You have to do it.
You have to do it. I love it. What is something that outsiders or maybe a few insiders don't know about the Brain Aneurysm Foundation?
I think some people don't even know we exist. It's kind of crazy. Couple of times we have a sign out in front of our building where people have stopped that had no idea you existed. And I think that some people, honestly, just more than the foundation, just the disease. They just don't realize the prevalence. They don't realize this disease is treatable, and they don't realize how important that early detection and knowing the signs and symptoms are.
Yeah, so true. I love that. And hopefully, Small and Gutsy will help you, but hopefully, though, as you continue, this will grow, and your website is amazing, and it's thorough.
Thank you.
And I also think that the push for physicians, EMTs, medical providers is so great because they're sort of the first person who may be able to ask the appropriate question when a person comes in. So I just love that. So you started to answer this question earlier, which is so funny. And I said, I wonder if she's going to say anything. If you could get one celebrity or influencer to endorse or talk about the Brain Aneurysm Foundation, who might that be?
There's a couple, but one now is pretty hot, is Martha Stewart. She lost her sister to a brain aneurysm, and she's pretty amazing, and anything she touches seems to translate pretty well. So, I mean, she'd be amazing. Dr. Dre, he's a survivor. He would be amazing. Bruno Mars lost his mother. He would be amazing. All people that we have outreach to, and we're not getting there yet, but we keep trying. And I wish, you know, if any of them see this, if they could only understand the impact that they could make in this disease, again, just by the social aspect, right? That social media influencing and sharing some of this data, if that's all they did, if they didn't give us a penny, and if they shared the statistics and the signs and symptoms just on the awareness piece alone, it would be amazing.
Yeah, it reminds me of years ago, like the seatbelt ads or things like to get people to change their behavior. If they could get people who've had something in their family or have a headache to go get a scan, and I'm sure all of them have because based on their family history.
I'm sure.
You know, or advocate from a policy perspective to say, this is really important. It's so undetectable if you don't have the symptoms that people aren't aware of, but if you do and it's not in someone's family or they're not aware that it's in their family,
right,
to get them to have a scan. So I love that. We'll hashtag folks, you never know, but
exactly.
On that front, you never know, but I love those because there are, even in your list, it's almost shocking to see how many have a connection to an aneurysm, right? You don't really think about it. And I think when it happens at a young age, it feels like such a fluke, but what you're telling me is actually not. And there's a way that in many cases it could be not prevented, but treated early. And so then the outcome, the impact are so much better.
Exactly.
So do you have any last comments or thoughts?
I mean, a big thank you to you for sure. But anybody that does listen to this, I mean, please share it. I mean, that is the key. The awareness and education. Unfortunately, we want aneurysms to be as well known, not because you had one, just because you are aware and educated on what the signs and symptoms are and that you could potentially save a life.
Absolutely. And I feel like if you've ever had to advocate for anything for yourself, add this to the list.
100%.
Because it really then creates a level of awareness for someone that they hadn't had previously, and they can ask their doctor.
Exactly.
And find out or do research in their family history.
Yeah.
So what's the best way for folks to reach you?
Go to our website, bafound.org, and email me at christine@bafound.org.
Great.
We are here for you. There's someone in the office 5 days a week and answering emails and phone calls, and happy to talk to anybody who has any questions.
And what's the other social media that you have?
We have Facebook, we have Twitter, we have Instagram, LinkedIn, YouTube, where we put all our stories and videos and things like that. So we're basically on everything. All the links are on our website, and everything's basically at BA Found. So
It's great. Thank you. I just want to take time to thank you for spending time with me and really helping me further understand this disease and how devastating it can be and how there is treatment. And there are options when you know, and the unknowing is what puts people in dire straits, really in jeopardy.
100%.
So, yeah,
Yes. No, thank you again so much. This was wonderful. I really appreciate it.
it was really fun. Please go to smallandgutsy.org to check out all of our episodes. And if you're so inclined, please purchase some Small and Gutsy merchandise, consider sponsoring an episode, or making a donation. Both are tax deductible and help keep us going and spotlighting these great organizations. The opinions and viewpoints expressed by our guests are independent and don't reflect the position or views of Small and Gutsy. Of course, we can't take responsibility outside of our own vetting of the organizations we interview, so before you sign on to support or work for them, we encourage you to do your own due diligence and research them as well. I want to thank my partners in this endeavor, the Intrinsic Group, the donors, the sponsors, and my incredible board of directors, Brianna Carmichael, John Gatto, Lucy Mello, Ari McCoy, Melissa Greitz, and Serena Rajabian, who believed in me in this project enough so to sign on to support this effort, and all the folks, friends, and family who have guided and inspired me. And thank you for listening. Together, we are spreading social impact, and you can help us. If you like this podcast, please share it with your friends. And don't forget to email me the name of any organization you feel would benefit from being interviewed. From small and gutsy to big with impact. I'm Dr. Laura Shirk-Witkoff, and thanks for listening.